Hello, thanks for stopping by. What I want to share today is a 3-month update on my treatment process with adalimumab, which is a biologic medication prescribed for a wide range of inflammatory conditions. In my case, it's prescribed for rheumatoid arthritis. It feels like a really good time to share an update because a couple of days ago I had an appointment with the hospital rheumatology team to review how things are going. So I can share what came out of that appointment and the plan for next steps. As you might know if you're watching this video, biologic medications, you're often warned that they can take a good few months to show full therapeutic effect. So it often is a bit of a waiting game when you try a new medication to see whether or not it will be effective for you and control your symptoms. What I want to do with my experience of adalimumab is share this process with you in real time. So perhaps if you're going through a process like this, we can go through this waiting game together. I'm going to aim for this video today to be a quick check-in, so short and sweet. But if you'd like a bit more detail on the whole process of starting adalimumab, my first impressions, I did post a video at the 2-month update that went into a bit more detail. So I'll put a link to that on this video or in the description box below if you're interested. But what I'll do today is check in on all of the same things. So injections, side effects, effects, and this time also the plan. Checking in on the injections first of all. I know they're an aspect of taking biologic medications that can be a little bit daunting. So what I will just say with those is no problems. No problems at all, still absolutely fine. So that's really good. In terms of the side effects, I was not having particularly intrusive side effects at the 2-month mark. That is still the case. If anything, I would say overall they are easing a little bit more. So I get a kind of really mild vertigo, nausea kind of sensation around the time I take the injection. It sometimes lasts into the next day, but it's mild. It doesn't tend to get in the way of anything I want to do. It varies anyway from dose to dose, it seems. But I would say in recent weeks, I'm noticing it even less. So it might be that it's decreasing or I'm just getting used to it. One thing that has developed in the last few weeks is I've been getting a really dry mouth, which might not sound like much. It's easy enough to manage during the day, but it has started waking me up during the night sometimes. My concern with that is really more about teeth and gum health, because if your mouth dries out, it's not very good for that. And that's something I personally have to be mindful of. But also, broken nights are not ideal. But so that's one thing that seems to have developed and has become more evident over the last few weeks. So I'll check in on how that goes. Another aspect of what was happening when I started the adalimumab was I was getting a really prickly, itchy sensation on my lower legs. And that was going on for quite a long time, and it tended to be after having a shower, bath, swimming, especially the shower. So I thought at first I might have developed a kind of sensitivity to toiletries. It's not that. I have been scientifically testing this out. So it's definitely not toiletries. I thought it might be some kind of sensitivity to water, but then it didn't make sense that it was affecting me more after a shower than bathing or swimming. And it's not over my whole body. It's mostly my lower legs. So I haven't worked out fully what's causing this yet, but I think the most likely candidate is that it's possibly friction where I'm rubbing myself dry with a towel, because my lower legs is probably a part of the body that's particularly affected by that, and it definitely seems to help when I just pat my skin dry really gently. So that's my current hypothesis. I will let you know if I discover any other reasons why this might be happening, in case it's something that is avoidable for anybody else. But overall, that is easing too. So whereas previously it was really intrusively itchy and it would last for a couple of hours before it would ease, it's passing much more quickly now and it's easier to ignore. And I find if I just don't focus on it, that seems to help it pass more quickly. But it's getting better. Now on to the effects that adalimumab is having. This is always a bit complicated when you take different medications and things are changing. And I had to stop my sulfasalazine, which was helping when I started adalimumab. So it complicates the picture a little bit. In my last video at 2 months, I mentioned that I felt I had turned a corner. So I'd noticed a real increase in heavy fatigue, and that had started to improve at the 2 month mark. And I'd also been having some joint symptoms returning, which are the kind of telltale signs of rheumatoid arthritis for me. So depending on what condition you're managing, obviously those telltale signs would be different. In the past few weeks, I have noticed that the joint symptoms have continued to be evident, and I think they might be getting a little bit worse. They do fluctuate a little bit from day to day depending on what I'm doing, but I have noticed in the past week I had a couple of really difficult days with my wrist and hands being quite painful. That affects me at work. Typing is quite jarring to my hands. I nearly put my splints back on at one point, but they're quite awkward to work in. And my walking is also affected. So my gait has changed a little bit, and it's just quite familiar from when I started to get unwell. With the fatigue side of things, it hasn't got back to where it was at the worst point, which is around 6 or 7 weeks after starting the adalimumab. But I have been noticing again in the last week or two, I am starting to get more tired. And occasionally, here and there, on weekends or non working days, I'm noticing myself needing to have a lie down in the afternoons or even have a nap. Just occasionally, but that's not something I've needed to do since the very early days of starting treatment for rheumatoid arthritis. So that is a change too. So it's hard to be certain. Like I say, things do fluctuate, but the impression I have at the 3 month mark is that adalimumab is not doing very much for me yet at this stage, which of course is a bit disappointing. It's quite disruptive going through this process of changing medications, stopping a medication that's helping, and dealing with the symptoms. But thinking back, it did take a good 3 to 4 months for me to notice a definite therapeutic effect of methotrexate. So when I first started my treatment, and even with prednisolone, so a fast acting corticosteroid, some people notice a change within a couple of days when they start a course of prednisolone, or prednisone is sometimes prescribed. For some people, it's even quicker. They start to notice even within a few hours. For me, I was started off on a relatively high dose of prednisolone at my very first diagnostic appointment with my rheumatology consultant. And a week later, when we followed up, it hadn't really made any difference, very little difference. So it may just be that my body responds to these medications quite slowly. And in that context, perhaps it's not so surprising, in fact, that I haven't seen a quick response or a really clear response just yet. I definitely haven't given up hope. So, last section, plan of action. What we're planning to do is carry on with the adalimumab until about the 6 month point so that it has a really thorough trial. I want to make sure I give it a full chance to see if this could have any therapeutic benefits for me, particularly because it does seem like my body doesn't respond especially quickly to these medications, and I definitely don't want to rule out any treatment options unless I have to. The next is that the rheumatology team are going to look into whether there's any possibility of reintroducing my sulfasalazine medication, because that was definitely helping and it's definitely made a difference stopping it. The rheumatology pharmacist who I saw a couple of days ago said to me that there aren't actually any contraindications between adalimumab and sulfasalazine documented in their reference materials. It's just that within the rheumatology team that's treating me, this is just what they've always done as a kind of precaution. They don't prescribe the two together. So she's going to look into that in a little bit more detail, find out exactly why and whether any concerns would apply to my particular case. So I might be able to bring that back in, which could help. And in the meantime, while we're waiting to see if adalimumab is going to kick in for me and whether it's possible to bring the sulfasalazine back in, I've been prescribed a steroid injection, so a high dose of corticosteroids, to try and get the inflammatory symptoms that seem to be returning under control quite quickly, in the hope that by the time the steroid injection wears off, it will be much clearer whether the adalimumab is going to be a therapeutic option for me or if it's just not going to work. And at that point, we'll be in a position to review again and make a decision about whether it's time to switch. So that's where things are for me at the 3 month mark. I'd be really interested to hear from you if you're going through this process at the moment too, how you're getting on with adalimumab or another biologic. It can be quite a bumpy road. Changing medications for these inflammatory conditions because they take so long to work and because it can mean a temporary increase in symptoms before things hopefully get better. So it's quite disruptive. Or it can be, and it can have an effect on your daily life. But I'm trying to take a long view with all of this, and I just think, in a way, you have to play the long game with conditions like rheumatoid arthritis. So hopefully, a bit of disruption and difficulty now at the early stages of my treatment. If that means I can find a treatment combination that gets my symptoms and the disease process really well under control. Hopefully future me will see the benefits. I try to think about all of this as a process of experimentation, of trying things out, of observing the effects, reviewing what's happening, and then adjusting or not adjusting, depending on what comes out of all of these different medications. And I find that approaching it that way, as an experiment, almost as an adventure in treatment, um, it helps to keep me feeling quite curious and interested in what's going on. And for me, that's kind of a more positive mental space to be in than feeling disheartened. So I don't know. I find that thinking about it that way helps with dealing with the more difficult bits. So that is where things are up to for me at this stage. I will check in again when I have my hospital review at the 6 month mark, or if something interesting happens or something significant changes before then, I will let you know. I'd love to hear your experiences of this too, if you feel like sharing, including if you've had a really good or quick response to adalimumab. There is so much variety in how people respond to these medications that I just think anyone seeing this video, I wouldn't want anyone to think that it's necessarily going to take this long, as it is for me. So having a full spectrum of experiences, if you feel like sharing them in the comments, I'm sure will help other people as well. That's it from me for now. So thank you for watching, and I will see you again soon.